Well, welcome everyone. My name is Lindsey Vajpeyi, and I'm the Director of Education and Outreach at Insight Memory Care Center. If you're new to Insight Memory Care Center, we are a nonprofit adult day health and resource center located in Fairfax, Virginia. Our mission is to ensure that those living with dementia have the highest quality of life, and we're there for those individuals through our care options, and we are there for family caregivers as well through our education and support. So this is part of a 4-part series called Demystifying Dementia. This is week 1, normal aging versus dementia. So I've got a little brain teaser for you, actually a few of them as we begin the class today. I want you to take a look at the picture on the screen. It looks like a tree, but if you look closely in that tree, you should be able to find 10 different faces. So I'll point one out to you just to give you kind of a head start. If you look here, you'll see sort of a head, an eye, a nose, and a mouth into the side of the tree, sort of like this. All right, so take a look at that tree and see if you can find 10. And however many you find, go ahead and type that in the chat box. All right, I see somebody found 10. 9 for another 10, 10, 10, great. Maybe those of you who found a few less than 10 are interested in seeing the answer, so here we go. So here are those 10 faces with a little bit of extra, extra drawing on there to fill them out a bit. So isn't that interesting how all of our brains so far are working very differently? I'll flip back so you can see the original again. I bet when you look at it now, you are much more clearly able to identify the other faces. All right, another brain teaser. So this time I'd like you to read through this paragraph and count all of the letter F's. So F as in farm, count every single F and see how many you come up with. Go ahead. When you find your answer, type it into the chat box. Sorry about that. Sometimes my screen flickers. Okay, I see 32, 27, 28. Anybody else? How many F's did you find? I'll give you a hint. It's more than 30. Any other guesses? How many did you find? And here are your answers. There are actually 36 F's in this paragraph. Which ones do you think that our brain glazes right over? I think for most of us, where we miss something is in the word of. I think we usually miss those F's. I think we often miss the F's that are right here at the beginning of a sentence. So there are actually 36. And one more little brain teaser. Take a look at all of the words on the screen, read through them, try to commit them to memory. And now, in this larger set of words, I want you to try to remember the words that were in the previous screen. Go ahead and type them into the chat box. All of the ones that you remember and that you're finding here. And again, if you just came on the line on the webinar, You can look for that little chat bubble. Anybody find one of those words or more? Go ahead and type them in the chat box. Not my thought process. All right. All right, here we have some: October, sadness, bean; June, anger, cauliflower; December, April. Yep, here's another: October, joy; December, carrot; pity; joy, sadness, cauliflower; December, January, April; October, compassion; April. Great, great, everyone. I think some of you may have found that when you think of them in categories, it's easier to remember. So for example, when you think about one of the months, maybe you remembered January. Once you think of January, it's like, oh yeah, there's also April and there's June and October and December, right? Or remembering just one vegetable, and then it's easier to remember the rest as well. But when they're all mixed up together, mixed around together, it's a little bit harder for our brains to commit them to memory. So those are just examples of how our brains work in really different ways. For the class this evening, we're going to be talking about normal aging versus dementia. So we're going to start with kind of normal aging, and then we'll talk about some of the warning signs of dementia and even what the word dementia means. So take a look at this picture. Has anyone ever encountered such a scene? Probably not lately, with all of us being at home, but maybe you've been, in a shopping mall parking lot and seen something like this, in like a kiss and ride or some other place where there's lots and lots of cars. And what do you feel? Do you feel a bit of fear? Where is my car? I hope it's here somewhere, right? Anxiety, maybe I'm also worried, I'm anxious about what's happening. I might feel late for something. Paranoid, did someone take my car? In denial, maybe even depression. Do you sometimes ask yourself, where did I put my keys? What was I saying again? What did I come into this room for? What was his name? We all experience these kinds of things from time to time, and it becomes more often as we grow older. We're all losing brain cells after around the age of 35, and that's normal and to be expected. So usually we'll eventually have some trouble coming up with names or words, and for some of us that happens more frequently than for others, and it will probably happen more often as we get older. It gets harder to multitask, to really try to do several things at one time. And when we say doing several things at one time, we think they're sort of overlapping tasks, but really what happens is our brain has to suddenly shift from one task to another. And that really quick shifting gets a little bit harder as our brain changes with age. As we age, we might have mild decreases in the ability to pay attention. Maybe it's a little bit more difficult to process information quickly. But as we age, we still learn new things, we create new memories, we can still improve our vocabulary and language skills. There are still plenty of things we can do. It's just that our brain is changing a little bit. So some of those things, like for me, it might be walking into the kitchen and thinking, what did I come in here for? Or I meet someone at an event and 2 minutes after they tell me their name, I've already forgotten it. That's pretty normal for most of us, right? But you kind of know what your baseline is, or for your loved one, what is my loved one's baseline? They've always been a bit kind of scatterbrained, they've always been terrible with names, or maybe my loved one was always really on top of things, always had everything organized, all of the details in place, and maybe now I'm noticing that changing and I'm a little concerned. So there are things that make kind of normal aging brain changes look worse than they really are. When we are experiencing a high level of stress, we don't think as clearly, right? It's difficult to make decisions. Maybe if we're stressed, maybe we're not sleeping enough, we're not sleeping well, and so we're feeling fatigued the next day, feeling just kind of groggy. Our brain just feels a little kind of like mush. Maybe we have anxiety and we're sort of hyper aware of everything that's going on and really on edge. It's hard to process information. Maybe we're experiencing depression, which has some kind of overlapping warning signs with dementia. We'll talk about that later. Or maybe you're on a medication that's actually making your cognitive function, it's impairing your cognitive function in some way. If you've ever had a procedure where you have been on a really strong pain medication, that can definitely affect your cognitive abilities. If you've been under anesthesia, especially for older adults, that can last in your system for a while. So these are things that, kind of take normal age-related changes and just make them appear worse than they are. If you are here as a caregiver, you have probably felt many of these things. You think, I hear comments a lot from caregivers like, oh my gosh, I just can't remember anything, but I'm also feeling overwhelmed. I'm not sleeping well at night. I haven't refilled my own prescriptions at the pharmacy. I'm feeling really anxious. All of these things just make our cognitive functioning, a little bit less desirable. So how can we compensate for kind of normal cognitive change that occurs? Or for someone who's even experiencing some mild cognitive impairment, potentially some early dementia. Some ways that we can compensate is to write things down. I know I do this a lot. I always have. I'm a list keeper. I've got my shopping list. I've got my to-do list. I even have a list of books that I want to read. I have to write them down or I'm not going to remember. We can all use electronic pillboxes, electronic reminders, maybe setting a timer on your phone, just different kinds of organizational systems at home for everything to be in its place and you can find it when you need it. We can focus on one thing at a time, and that's going to help our brains, again, really focus on that task and be more effective and be more efficient. Rather than trying to pay my bills and talk to my family and boil the water, for something I'm cooking for dinner, and just shifting between one thing and another, focusing on one at a time will be more helpful. We can allow enough time for tasks. When we're trying to rush through something, we tend to make more mistakes, we become more frustrated and the whole thing is just more difficult than it needs to be. We could ask others to slow down when they're presenting information to us. I think about being at the doctor's office and the doctor maybe sharing a lot of information, using vocabulary that's not very familiar to me, and really taking that time to ask the doctor to slow down a bit, to give me an example, to tell me in another way, to repeat themselves. And we can always ask for information in writing as well. So normal aging depends on a number of factors. It's not just one thing. And for the purposes of this presentation, we're talking about aging as it relates to your brain health specifically. So aging well depends on your genes. What kinds of things are you at risk for? What things did you inherit from mom or from dad? It depends on our environment. In our immediate environment, there are some things that we can do to kind of protect ourselves and protect our brains as we age. I think about things like removing any tripping hazards in our home to reduce the risk of falling and hitting our head and having a cognitive change related to that. But as far as our larger environment, there's only so much that any one person can do that's going to have a direct effect on your own brain health. But lifestyle is really where you have the most control. Healthy lifestyle choices can help us maintain both a healthy body and a healthy brain. Now, if you do everything perfectly, you're doing everything the books say, what I say, what the doctors say, it still doesn't mean that you have totally eliminated your risk for dementia. Even if you do, quote unquote, all of the right things, you still aren't able to control the genes. You're not able to control the environment. There are probably other risk factors that we aren't even quite aware of when it comes to changes in brain health. So by living a healthy lifestyle, by making good choices, this is the way that you can do as much as you can, to do whatever's within your control to help your brain age as well as possible. So these are the topics we're going to cover in the next few slides. What can we do to protect our brain health? So we're going to talk about taking care of your health, eating healthy foods, being active, learning new things, and connecting with others. When it comes to taking care of your health, it's really important to visit our healthcare providers on a regular basis, to get our recommended health screenings when they're warranted, when they're needed, to be in touch with our physicians to manage health problems, For example, if you're diabetic, if you have high blood pressure, high cholesterol, those sorts of issues. We want to make sure that our doctors are aware of all of the medications that we're taking. So this is not only prescription medications, which you may have many of, some coming from specialists, some coming from your primary care doc, but also vitamins, supplements, any other things that have the potential to affect your body, affect your brain, have interactions with each other. We can take care of our health by reducing our risk for brain injuries due to falls and other types of accidents. So something like buckling up in the car is a really good idea. Wearing a helmet when you ride a bike, being really careful on wet or slippery ground, and doing whatever is necessary to prevent falls. So for example, for an older adult, thinking about picking up any throw rugs that you might have around the house. And taking care of your health, quit smoking. If there's anyone out there who's smoking, I know you've heard this 1,000 times before for lots of other reasons, but we know that smoking is pretty terrible for our health. Not only our lungs and our circulatory system, but also for our brain health. Another way to take care of ourselves is to eat healthily. We want to think about having a plate that's full of fruits and vegetables, whole grains, lean proteins, lean meats. And if we're going to have dairy products, focusing more on the low-fat and non-fat dairy products. We want to, really minimize the amount of solid fats, sugars, and salts that are used in our food. It doesn't mean that we can't, have a little bit of the things that aren't really good for us, but it's not something that we want to be a regular, substantial part of our diet. So generally we want to think about something like a Mediterranean style diet, or a DASH diet, dietary approaches to stop hypertension, or there's another diet called the MIND diet, which is basically a hybrid of those two, MIND, M-I-N-D. And all of these diets are very similar to each other, and they're really focusing on fruits, vegetables, lean proteins, seeds, nuts, all of those kinds of things. When it comes to fruits and vegetables, when you're thinking about brain health, there's some research that indicates that berries and dark leafy greens are especially good for brain health. So things that you might consider including in your diet. We do want to think about proper portion sizes. Here in the US, we tend to eat too much, especially if we go out to eat. The size portions that we get are really enough for probably at least 2, if not more meals. And it's also really important that we get adequate fluid intake. Just plain Jane water is really the best thing for us. When we stay properly hydrated, it helps all of our systems work more effectively. It can prevent things like urinary tract infections. If you're a coffee or a tea drinker, I'm not saying totally give up your coffee or your tea, but after you have that cup of coffee in the morning or tea in the afternoon, trying to really drink lots of water throughout the day, because anything that's caffeinated actually can be a diuretic and dehydrate you. So here we have an example of a Mediterranean diet. So you see at the bottom of this food pyramid, lots of fruits, vegetables, whole grains. We've got some fish and seafood, then a bit less of the poultry, eggs, cheese, and yogurt. And at the top of the pyramid, very little of meats and sweets. We see on the left, drinking water is really, really good for us. We also see wine in moderation. So part of the Mediterranean diet is to have a glass of wine, especially red wine with a meal. There is not any research that supports, starting to drink wine. If you weren't previously drinking wine, you don't need to add this. But if you are someone who likes wine, having a little bit might not be a bad thing for you. We'll talk more about that in a few minutes. And then you see at the base of this pyramid, we've got olive oil, so focusing more on the healthier vegetable like olive oils rather than solid fats like butter or lard or shortening and things like that. We've got beans, nuts, seeds, herbs, spices, and then daily physical activity. Really, really important. So we'll come back to physical activity. As far as alcohol, it's important that we avoid excess alcohol. So guidelines for adults would be up to 2 drinks a day for men or 1 for a woman. If someone is age 65 or over, then it's actually about half that. So about 1 drink a day for men and even less than 1 drink a day for women. And we also have to think about, well, what is a drink? So for example, a glass of wine would be about 5 ounces of a 12% alcohol wine. If I'm drinking maybe that wine glass but filled right to the brim, that's actually a couple glasses of wine, not just one. Now, alcohol can have a detrimental effect on brain health. It can slow or impair communication among brain cells, even with moderate alcohol use. When we're under the influence of alcohol, that of course affects our driving ability. We might have slurred speech, fuzzy memory, drowsiness, dizziness, but even long-term, there can be changes to balance and emotions, coordination, and body temperature. There's actually a form of dementia called Wernicke-Korsakoff syndrome that is specifically related to a vitamin B1 deficiency. That's really the effect of long-term alcohol use. So get moving, a really important way to stay healthy. When I talk with researchers who focus on brain health, they share some of the same information that I'm showing you this evening. But when pressed, if there's really one thing to do, if you can only manage one, what has the most support within research, it is to get moving. Physical activity is really the best thing you can do for your brain, for your body, for your mental health, all of these things. So when we're physically active, we can reduce our risk of things like diabetes, heart disease, depression, stroke. And when we think about risk for dementia, for diseases like Alzheimer's, having things like diabetes and heart disease does seem to increase risk for dementia as we age. When we have more physical activity, we improve blood flow to those brain cells. Think about that blood flow like fuel for brain cells. So the more we can get that fuel up there, the stronger we can keep the brain cells. By physical activity, we can improve connections among brain cells, and we can also keep ourselves physically strong to hopefully prevent things like falls. There's a standard recommendation that we should all get at least 150 minutes of exercise each week. So you decide how you break that down. Maybe it's 30 minutes a day, 5 days a week. There's lots of options for exercise. There's really no perfect thing because it depends on your body, what you can handle, what you feel comfortable with, and also what you enjoy. If you don't enjoy it, you're not going to continue on and you're not going to get the benefit. So maybe it's walking. That's a good start for a lot of us. Doesn't require any special equipment. You can do it almost anytime you want. There are other programs that you can join that could help you move safely. Right now, when we're all spending time in our own homes, there have been a lot of online fitness programs that have given free access. I believe YMCA, and there's lots of other programs that you can find to move safely. And when everything reopens, our community centers and senior centers and gyms, there's a lot of options. But you do want to check with your healthcare provider if you haven't been very active and you want to start a vigorous exercise program. Sleep is really important for our brain health. Inadequate sleep due to conditions like insomnia or sleep apnea can result in problems with memory and thinking. When we're sleeping, it gives our body time to build proteins and other brain boosting components. So if you are feeling like you're not getting very satisfactory sleep, it would be a good thing to check in with your physician about. To keep our brains as healthy as possible, we want to keep our minds active. We think about something like use it or lose it as far as muscle tone, but it seems like there's something to be said for that even when it comes to our brains. So we want to do mentally stimulating activities. Maybe that means for you, it's reading books and magazines, and really reading something that challenges your brain, not necessarily kind of lighthearted, just entertainment kinds of things, but doing something that really makes your brain work a little harder than it's used to. Playing games is really great, especially games that involve strategy. So thinking about things like bridge or like chess, these are great ways to keep your mind active. Learning new things is a great way to keep your brain active. Learning a new instrument, a new language, a new hobby, a new skill, or maybe something that you did years ago and you've decided to pick up again. Taking or teaching a class is a great way to keep your mind active. So I'm glad you're all here taking this class this evening, but even considering taking additional classes in areas that interest you, or maybe you have a talent or a skill that you're able to share with others. And being social through work or through volunteering is also a really great way to keep our minds active. So clinical trials haven't proven that these types of activities will prevent Alzheimer's disease, but it does show that using your mind can reduce the risk of cognitive decline with age. And also the activities can be really fun. Staying connected is an important part of keeping our brains healthy. People who have meaningful activities like volunteering say they feel happier and healthier. Social activities are linked to reduced risk for some health problems, including depression and dementia. So we can't exactly say that being social, directly reduces your risk for a disease like Alzheimer's, but we do see in kind of large scale studies that people who are more socially active are at less risk of having dementia. So there are lots of social and other programs in our communities through your area agency on aging, community centers, senior centers, lots of other community organizations. Listening to music is great for your brain, especially music that has some meaning to you. Music can be good for enhancing our cognitive functioning, our verbal fluency skills, improving mental focus, and lowering stress hormones. Another way to keep your mind active is to use all of your senses. Think about how you can take something that you might be doing anyway and really be more mindful of all of the ways that you can experience it through your senses. So I'm thinking about something like gardening, being outside, watching all of these azaleas bloom, really not just kind of seeing them in a passing way, but really taking a close look, smelling, touching. I also think about creative arts like sculpting, ceramics, not just kind of doing something to accomplish a task, but really being mindful of all of the ways that you're experiencing this through your senses.
Lindsay, we have a question
Okay.
at the chat box. Kathy wanted to know, in reference to physical activity being the most important, she wanted to know, is it compared to what other big categories? And what she asked was the answer, diet, sleep, or medicine.
Right. So when you think about brain health, kind of the main 4 pillars, or there are different ways to break this up, 4, 5, 6 pillars, but the main pillars would be like physical activity, a healthy diet, cognitive activity, and social activity. So of those 4 pillars, physical activity is really like the thing that's backed up the most with research. People who are more physically active over their lifetime tend to have lower rates of dementia as they age. You're welcome, Kathy. So what can you do today before we pivot more into kind of the dementia side? I would challenge you to pick one thing that you can do that might help your brain. So just think of something small. This is not a New Year's resolution of, I'm going to exercise for an hour every single day. I'm going to only eat fruits and vegetables. I'm going to, I'm going to sleep 10 hours a night. And, by January 15th, we've given up on all of that. It's just too lofty. It's not attainable. So think of one small thing that you can do. Maybe it means taking a 10-minute walk every morning or a couple times a day. Maybe it means making sure there's a serving of vegetables at least a couple meals each day. Drinking a full glass of water, in the morning and another couple glasses in the afternoon. Maybe it means calling and setting up that doctor's appointment that you've been putting off, or picking up the book that you've been meaning to read. Thinking about small first steps. Write down what you're going to do and when. And if you want some accountability, go ahead and put it in the chat box. And maybe someone else in the class or Marquita or I will remember to check up with you about that sometime. Write down what you're going to do, when you're going to do it. Make that plan, put it in writing, and then get some support from others, from family members, from friends, from community groups. You may find that there are lots of other people close to you who share a similar goal. Hey, I'd love to get outside and go for a walk more often too, right? Or I've really been meaning to start a book club. Maybe I've always been an avid reader, but how do I take that to the next level? Maybe I should get together with other people and discuss what I've been reading, challenge my brain to work in different ways. So think about one thing that you're going to do starting tomorrow. Great, Kathy. Salmon twice a week. Love that one. Get into gardening again. Great. Thanks, Susan. So let's pivot now. So we've talked about normal aging, brain health. Let's talk about, okay, but what if things are going on that seem like they're not really a normal part of the aging process? So the word dementia is not a normal part of aging. Dementia is not one specific disease. Dementia is just kind of a general word that we use to describe a group of symptoms. And these symptoms, generally affect memory, thinking abilities, judgment, language, social abilities. And these changes are severe enough that they're interfering with daily life. They're getting in the way of daily functioning. So this is not like, oh, every once in a while I forget the name of somebody. This is like, it's really starting to affect my life. People around me are noticing. It's harder for me to, to really manage the day totally independently. So like I said, dementia is not a specific disease. It's just kind of a general category that we use. Like I said, I don't have my dementia umbrella on here. So let me address one of the most common questions that I get. What's the difference between dementia and Alzheimer's disease? Dementia is that umbrella term, and Alzheimer's is a specific type of dementia. It's the most common form of dementia. So if somebody has Alzheimer's, they do have dementia. If someone has been diagnosed with dementia, it's not that diagnosis alone is not telling you what's causing those symptoms. It might be Alzheimer's disease, it might be vascular dementia, it might be Lewy body, it might be any number of different types of dementia. We will touch on those at the end of today's class, but then next week's class, Diagnosis Dementia, Now What? That's going to get much more into some of the different forms of dementia. So let's take a look at warning signs. So this is a list of warning signs that has been compiled by the Alzheimer's Association. So there's 10 warning signs. I'll kind of walk us through and I'll give some examples. And if you have any questions, go ahead and type them in the chat box. So the first warning sign, particularly for Alzheimer's disease, is memory loss that disrupts daily life. So I'm not talking about things like, oh gosh, I forgot to stop and pick up some milk on the way home from work. We all forget things from time to time, right? Oh, I forgot I told Susie I was going to give her a call tonight. That's not what I'm talking about. I'm talking about memory loss that really is disrupting daily life, really forgetting about important events. Maybe you have a family member who is asking you every day why you can't go somewhere, who's forgetting that we're all on these stay-at-home orders right now. That kind of memory loss. Forgetting recently learned things, that's most common. So you may find that your loved one or your friend can talk at length about things that happened decades ago, about childhood, about going to college, meeting their sweetheart, about their career, but asking what you had for lunch today, if you took your pills this morning, remembering that the granddaughter called yesterday, those are the things that people are much more likely to forget early on in the disease process. So what you might see is that friend or that loved one asking you the same question over and over again, telling you the same story over and over again. But again, we have to know what this person's baseline is. Oh, my screen's doing its little flicker thing for some reason. Sorry, just a second. So I'm going to pick on my mom. I'm going to use her as an example. She does not have dementia, but her normal is that she will tell me something over the phone, tell me a story, tell me about something that happened this week. And then when I talk to her next week, she will tell me the same story that she told me last week. However, our main way of communicating is over the phone. She talks to my sister on the phone a lot. My dad has a job that takes him away from home, so she talks to him on the phone a lot, and she just doesn't keep track of who she told what to. So that is totally normal for her. It always has been. But you may know for your loved one that this is really something different. This is not kind of their personality trait. It's something new. Let's see. So I see something in the comments. Sometimes I think this project is just too hard for my brain. So thinking about a complex project. So like, should we do a will or a trust? That is, I would not call that memory loss. I think it's just that we all have different, our brains work in different ways, just like in the beginning with those brain teasers. For example, some people are really good at money, at stock markets, at making financial decisions. And some of us, like me, that is not my comfort zone, right? Other people are good at lots of other things, good at working with their hands, good at designing, good at building. And for other people, that is not their thing. So anytime there's a really complex decision that needs to be made, but it's totally outside of your comfort zone. It's outside of your, kind of lived experience. That's common that it's going to feel complex. For your loved one or for you, if you're feeling like things you used to be able to do have become significantly harder. So right now we're in tax season, and maybe you have done your family's taxes for decades. And maybe you even work in finance, you've been an accountant. And now if you're having difficulty with simple math, if you're really having difficulty with taxes, I mean, it's something where we can get rusty because you only do it once a year. But if really math has been your strong suit and you're struggling to balance a checkbook, you're struggling to put the taxes together, that's a change from baseline. That would be something to be concerned about, whether it's dementia related or not. It's a change to be a little concerned about. So the second warning sign is challenges in planning or solving problems. So like for you to be on the webinar this evening, you had to make a plan, right? I have to get dinner done. I have to put the dishes away. I have to get the computer fired up. I need to find the link. I need to click on it and be ready for the class at 7 o'clock, right? You had to plan. You had to go through a series of steps to get to your goal. And then let's say a problem arose. Okay, your computer won't start. Okay, well, someone with a healthy brain usually would work through, try to figure out what's wrong with my computer. Right? Did I drop it recently? Is it just not charged? What's going on with my computer? And you'll probably figure it out. So normal aging, maybe it takes us a little longer, but we figure it out. When this comes to a warning sign, this is maybe for your loved one who's really having difficulty with sequencing, really having difficulty with common problems that might arise throughout the day, or even uncommon problems. Think about if your stove started on fire. Solving that problem, what would you do? Maybe you put out the fire yourself. That's healthy aging. Maybe you call the fire department, depending on the size of the fire. That might be the best way to deal with it. But let's say I call my brother living in Florida to tell him my stove is on fire. Is that really the best way to solve this problem? Probably not. So things that require planning, thinking about making a favorite recipe takes planning, right? What supplies do I need? Groceries and cooking equipment, and how long will it take me to accomplish this task? That's an example of something that requires planning and sequencing. So if you have a loved one who's really starting to struggle with this, can't put together simple meals like they used to, has difficulty in the morning with getting dressed and knowing what order to put pieces of clothing on, these are examples of changes in planning and solving problems. The third warning sign, difficulty completing familiar tasks at home, at work, or at leisure. So when I say familiar tasks, here's an example, like this is not a familiar task. Putting together your will or your trust, not a familiar task. So that might be difficult, and that's to be expected. Familiar tasks could be like using your microwave, right? Getting dressed, brushing your teeth, throwing in a load of laundry, driving your car to familiar places. Those are familiar tasks. For someone whose brain is starting to change, those kinds of tasks may become much more difficult. Maybe this is the same remote control that I've had for the last 5 years, and now I'm really struggling to figure out how to turn my TV on and off, right? Or it's the same phone that I've had for the last few years, and I can't quite figure out how to send a text message. Now that's totally different than I got a new phone and I don't know how to use it yet. So thinking about if you or your loved one is really struggling with just kind of common tasks that have been things you could do previously, but now are becoming much more confusing. The fourth warning sign is confusion with time or place. So confusion with time, that's things like kind of getting days and nights mixed up. If you have a loved one who's waking up in the middle of the night and thinking it's time to get up and go to work, at 2 a.m. Maybe for somebody who's retired, that would be some confusion with time. Also, the passage of time is really an abstract concept. So, if you have a loved one who's experiencing some memory loss and you tell them, our family member is coming to visit us next month, isn't that exciting? And every day between now and next month, they ask you if today is the day, right? That's an example of it's really difficult to figure out what is a day, a week, a month. That's some confusion with time. And of course, being able to kind of tell time and follow a clock could be part of changes with this warning sign too. Confusion with place as well. So typically in the early stage of dementia, being at home is not, particularly confusing, but going places that are not as familiar. So maybe going to stay with my family member for the weekend, even though I've been there a dozen times before, that could be really disorienting to someone who's living with dementia. It can be really hard to go to new places. Maybe even going to a doctor's appointment and sitting in the waiting room and you find your loved one asking you, what are we doing here? I want to go home. It might be a sign that it's the change in place, the change in location is starting to become really difficult. The fifth warning sign, trouble understanding visual images and spatial relationships. So let's talk through this one a little bit. This is not a problem with your eyes. Normal aging, sure, our eyes may change. You need an update in your prescription. Maybe you have glaucoma or macular degeneration or something like that. But when we talk about this warning sign, it's really not about the eyes at all. It's about the way the brain processes the information that the eyes bring in. So an example of this would be maybe you're walking with your loved one down the sidewalk. You get to a point where you need to step down into the street. You see it, you kind of adjust your pace and when the step is coming. Maybe your loved one doesn't. They don't see that. They don't see that there's a change in depth. Or you have a set of stairs at home and all of the stairs are the same color, right? They're the same carpet pattern or the same wood pattern. And your loved one's brain does not identify that there's going to be a change in depth. So maybe they're, walking there at the top of the stairs, they get to that, that landing. They're not expecting that they need to take a step down and now your loved one falls down the stairs. So thinking about depth perception is important, and this can play into when you're driving a car. How close do I need to be to the car in front of me or how far back? Also, in addition to depth perception, color contrast. So like when I was talking about the stairs, that's an example of having difficulty with color contrast. Let's say you and your loved one are sitting down to a meal and you've got a white tablecloth and you've got a white plate and you've got rice on your plate. And your loved one might be starving, might be commenting on how hungry they are, but they're not eating their food. It may be that their brain does not identify that there's food in front of them because everything is white. It's white on white on white, and their brain cannot tell the difference. So again, this is not about the eyes, it's about the brain processing that information. The sixth warning sign is new problems with words in speaking or writing. So this could be things like word finding difficulty, which we all have trouble thinking of the word once in a while, right? Or we're trying to think of someone's name and we can't get it out, or we're trying to remember an address and it's like on the tip of our tongue. But this is when it really starts becoming a problem in daily life. It starts becoming kind of a pattern that someone's having difficulty thinking of the words that they want to say. You may find that your loved one is speaking less. They're not as likely to kind of jump into a conversation and kind of keep up their end of the conversation. You might find that your loved one, even if you write something out, like you write out today's agenda, you write out a list of instructions, your loved one may be starting to have difficulty following that, processing, kind of converting that information that I might see in writing, and I might be able to sound it out and read the words, but it doesn't mean it's making sense in my brain. So what I see oftentimes in the early stage of the disease is that person maybe finding different ways to describe an object rather than naming it. Like, for example, saying, have you seen my hand clock instead of have you seen my watch? Or can you hand me that thing instead of can you hand me that fork? Now, we all do this sometimes, but this is when it really starts to become kind of a pattern. The seventh warning sign is misplacing things and losing the ability to retrace steps. So it's really not losing things that's a big problem. We all lose things sometimes, and maybe for you or for your loved one, again, everyone's different, and maybe your loved one they've always lost things. They've never known where their keys are. They've never known where their glasses are. It's not really the losing things that's a big problem. It's losing the ability to retrace steps. So if I'm leaving my office and I'm about to head home and my keys are not in my purse where I think they should be, I'm not going to assume that someone came into my office and stole them. I'm going to think, oh, okay, well, where was I? Maybe I made a trip to the bathroom. Did I drop them there? Did they fall down under my chair? Are they in my cabinet? Maybe I left them in the car. Are they in my coat pocket? I'm going to be able to retrace my steps, remember where I was, look around, and probably find my missing item. For someone who's living with dementia, that's just really hard for the brain to do, to be able to kind of walk backwards in your mind and put all the pieces together. So another example of this is when someone is putting things in really unusual locations. So if you're finding, the car keys in the freezer, you're finding the money or the wallet hidden in the shoebox up in the back of the cupboard. I mean, again, we might all do strange things once in a blue moon. Maybe I'm putting away groceries and the keys slip out of my hand into the freezer when I'm putting groceries away. But this is when it's starting to become, again, a pattern. Maybe my loved one is putting the dishes away from the dishwasher and everything is going into really strange places, or they're putting laundry away and the towels end up in the food pantry, things that are really a change for that person. The 8th warning sign is decreased or poor judgment. We might all make a bad decision once in a while, but this is when it really is starting to affect everyday life, really having difficulty with money management, falling victim to scams, people who come by your house and want to cut down your trees and give you new windows and all these different things, all of the mailers that come in requesting money from every other organization, and this person just giving more money than they can afford to give, forgetting that they've given money and giving more, giving money to family members or friends who are preying upon a vulnerable adult, really. And judgment goes beyond money management. Judgment is, I need to have my headlights on when I drive after dark. I need to have the wipers on when it's raining. I need to wear clothing that's appropriate for the weather and the activities that I'll be pursuing today. The 9th warning sign is withdrawal from work or social activities. So it's this person pulling back from the things that they used to do. Maybe I used to go to an exercise class a couple times a week, every single week, and I haven't been doing that anymore. Maybe it's I used to volunteer and I've cut back there. I've retired early from work. I used to go to my faith community for services every week, and I'm not doing that anymore. This could be intentional for some people. It could be that, I'm aware of my brain changes. I'm aware that I'm more forgetful than I used to be. I can't remember people's names, even people I've known for a really long time. And I don't want to embarrass myself. I don't want anyone to notice these changes that are occurring. So it might be intentionally pulling back. It might also be that this person's brain, because of the way it's changing, they're just not able to initiate what they used to do. To remember that it's, it's Saturday or it's Sunday and this is the day that I go to my faith community, or it's, Monday morning when I always go to my exercise class, and that person just may not be remembering and also not initiating these activities. And then the 10th warning sign is changes in mood or personality. This might mean becoming more confused, more anxious, more fearful, more irritable. And again, it's looking at, well, what's my baseline, or what's my loved one's baseline? If my grandmother was always very, kind of polite, very put together, very cool, calm, and collected, and now she's saying words I've never heard come out of her mouth before, and she's snapping, and she's seems like she can't quite control her emotions. That's what I mean by a change. So thinking about, what's causing this change? Again, like any other warning sign, there could be lots of different reasons that this occurs. Maybe my loved one has a change in mood or personality, but they're actually grieving the loss of a friend or a family member. And so they're going through these kind of cycles of maybe anger and feeling scared and feeling worried, not sleeping well. So it's trying to determine, is this normal for my loved one? And if it's not, what could be causing this change? Now, I mentioned earlier how there's kind of overlapping warning signs with depression and dementia. So if you think about these last few warning signs, for example, if you just saw these in a vacuum, you really wouldn't know if it's depression or dementia, right? Even with depression, it could be difficult to make decisions, to use good judgment. Maybe I'm pulling back from all the things I used to do. I've had a change in my mood. I'm really depressed, withdrawn, maybe I'm irritable. So just seeing 1 or 2 warning signs kind of on their own doesn't tell you that it's dementia. But if you're noticing in yourself or in a loved one, a number of warning signs, or even just a couple that are significantly different from their baseline, it's a good idea to talk with a doctor to try to figure out what's going on. So I see a question in the chat box. Is the personality change usually for the negative? So it could go either way. I would say usually when you're noticing change, I think we're more likely to notice something that's negative. So maybe somebody who was always kind of crabby their whole life and is becoming a little more mild, we might not pick up on that right away. We're happy about it, but we don't necessarily see it as a problem. But let's say it's somebody who always was, very mild-mannered and now is becoming really anxious, paranoid, irritable. I think that's where we pick up on these changes more quickly. And you can go ahead and type in questions anytime you want. So here's my dementia umbrella. So again, dementia is just an umbrella term, and you see on the left a number of irreversible forms of dementia, so including Alzheimer's disease, vascular dementia, dementia with Lewy bodies, frontal temporal degeneration, Parkinson's disease dementia, and many, many others. But then on the right, we see a list of reversible conditions. So even if these symptoms are present, maybe you're seeing some of these warning signs in a friend or a family member, we don't know for sure that it's something like Alzheimer's disease. It's quite possible that there is a reversible or a treatable condition that's causing these symptoms. So examples would be an infection, especially a urinary tract infection, a bladder infection, can really mess with our cognitive abilities as an older adult. But other kinds of infections as well. If your loved one has some kind of a respiratory illness, if they have pneumonia, all of these things can have a cognitive side effect. But then when the infection is treated, like the urinary tract infection, you get on the right antibiotic, after a few days, all of those symptoms go away, and cognition goes back to baseline as well. We mentioned depression a couple of times. Depression is something that there are treatments that can be effective, whether it's more of like a talk therapy and counseling, exercise, or medication-based treatment. If we can address the depression, it might make the symptoms go away that we were questioning if they were dementia. Often people who have dementia also can have depression, so it can be difficult to tease the two apart. But they do each have kind of their own set of warning signs, and when looking at someone's history and baseline, it's certainly possible to try to flesh that out. If there were a brain tumor, of course, that could affect cognitive abilities and again could be treated. A metabolic disorder like a thyroid condition, it could be a medication that's causing these cognitive changes. That can be a side effect of some commonly prescribed medications. It could be that you have one doctor prescribing one thing and a different doctor prescribing something else, and there's some kind of an interaction that's occurring. Or medications, like a pain medication, there's something that's sedating. It could be a vitamin deficiency. We think about like a vitamin B12 deficiency being something that doctors would look at, in a panel when they're trying to determine what could be causing cognitive changes. It could be alcohol use. There's lots of things that could present symptoms that fit with the term dementia, but it's actually treatable or reversible. So again, it's really, really important to go and see a physician, to get in touch with the physician to try to determine what's causing these symptoms. I would suggest starting with a primary care doctor, hopefully someone who knows their patient, has some history with them, who knows medications, who knows, what's going on with different medical conditions. The primary care physician would do things like look at the medication list, draw some blood, do maybe some basic cognitive screenings, check reflexes, look at the potential for other neurological conditions. So the primary care doctor would be like the first stop. And after the primary care doctor, they may make a referral, or you may find that your primary care doctor is just saying, well, I don't really know what's going on, or just kind of brushing it off. Well, you are 85 years old, kind of what did you expect at this age? You don't have to stick with that answer. Kind of the next line there to go to would be a neurologist. a neurologist would look more intensely at any kind of neurological condition. So what are they going to do? When we're diagnosing any type of dementia, especially thinking about the irreversible forms of dementia, first they're going to rule out any other causes, right? They're going to draw blood, they're going to check reflexes, they might do brain scans, they're going to ask you about your sleep and your stress and look at your medications and try to rule out anything else that it could be. Well, it's not depression, there's no evidence of stroke, there's no brain tumor, the medications look okay, etc. So another reason that an early diagnosis is important, to really address these symptoms early on, is that there are medications that can be helpful for these symptoms. So if your loved one is experiencing memory loss and the doctor has determined that it's probable early Alzheimer's disease, there are medications that are FDA approved that can be useful for those symptoms. Now, these medications don't actually slow down the progression of the disease. They are not a cure, but they are really helpful for many people just with kind of the symptoms. With everyday life, it can make it seem like cognition has plateaued or even slightly improved. But the only way... It's
a lot.
Hello? Marquita, do you mind putting everybody on mute? Thanks. So with these medications, we really only can access them through physicians. So you may have heard of medications like Aricept, Namenda, Razidine, Exelon. These are the kinds of medications that are FDA approved to use for Alzheimer's symptoms, and sometimes they're used for other forms of dementia as well. So I see a question. If your loved one is showing some of these symptoms, do you suggest any particular way to bring this up with the loved one? Do you consult the loved one's doctor or get the loved one to go? Really good question. And that is one of the big challenges, I think, in the beginning, especially if your loved one is not noticing these changes in themselves or not willing to admit it. And I mean, it makes sense too. If my loved one is experiencing memory loss, they may not remember all of the strange things that have happened. They don't remember getting lost in the car yesterday. They don't remember that I've already told them this story. So I would try to be really empathetic and approach my loved one about it, to be really kind of open and supportive. I've noticed that this is becoming a little more difficult for you, or it seems like, maybe something has changed, and can we talk about it? And it may be that your loved one has noticed these things, but hasn't felt comfortable bringing it up with anyone else, is kind of hoping that nobody else notices. So I would first try by approaching my loved one, really being kind of warm and understanding and kind of partnering with them, right? It's not animosity. It's, I'm here for you. I'm here with you. Let's look at this together. Let's say your loved one is not accepting of that at all. They absolutely feel there is nothing wrong. And it could be that they really don't see it. The way their brain is changing does not allow them to recognize these changes. Or it could be denial, like an emotionally protective mechanism. So it's really important to get your loved one to the doctor, or in some way, shape, or form. I mean, really, it's the doctor who has to address this. Maybe it is a medication problem. Maybe it's a vitamin deficiency. It's the doctor who has to figure that out. So if you can somehow convince your loved one to go to the doctor, that would be best. I mean, right now you probably have to do it telehealth or some other way. If you can go into the appointment with them, great. If your loved one won't allow you into the exam room with them, what I would suggest is to somehow contact the doctor's office in advance. So I would say maybe you call a day or two in advance and talk with the physician's nurse. Say, I'm a family member, here are my concerns, here's what I see at home. I'm pretty sure they're not going to bring any of this up with you in the appointment, so I wanted you to know. Or maybe if you go to the office with them, but you don't go into the exam room, maybe you can bring a letter, something that you can slip to the receptionist and say, can you share this with the doctor before they come into our room? Somehow share information about what you're seeing at home with that medical team. And if your doctor, if your loved one won't go to the doctor at all, they just won't do it. You might find some other creative way to get them to go. And this is, definitely not the first thing you'd want to do, but kind of a last resort would be to maybe pair this with some other more enjoyable outing, you know, going out for lunch with a friend and then you happen to swing by the doctor's office on the way home. You know, maybe sharing with your loved one that insurance won't continue to pay for their prescription refills unless you go in physically, you know, or over the phone to see a doctor, you know, by some way getting them in there. Or there are doctors teams who will come and visit out in your own home. So there are a number of those in this Northern Virginia area. And if you're somewhere else around the state or around the country, trying to determine if there are any home call or house call doctors in your area can be another way around this. So other reasons that it's important to get that early diagnosis, getting involved in a clinical trial. You know, most of the clinical trials are really focused on people who have early stage symptoms or even aren't yet diagnosed, who have sort of subjective cognitive changes. Getting involved in clinical trials is a fabulous way to be in touch with experts in the field, and also planning for the future. So this is what we're going to get a lot more into in next week's class, especially this planning for the future piece. So I hope that you can join us. Here are a list of resources that focus on things like brain health. You can find information about Alzheimer's disease, exercises for older adults, all kinds of different things. And again, if you're new to Insight Memory Care Center, this is a little bit about us. We offer care, education, and support to people living with Alzheimer's and other forms of dementia, as well as their families, the community, and professionals.